Understanding and recognizing the warning signs of depression. Clinical depression is often misunderstood, partially because the term depression is sometimes used out of context. A consequence of these misunderstandings is that some don't even realize that they are experiencing depression. Likewise, if you suspect someone you know has depression, it may be very difficult to determine based on popular perception of what it is. What is depression? Depression is defined as extreme sadness or despair that lasts more than days and interferes with the activities of daily life, and can cause physical symptoms such as pain, weight loss or gain, sleeping pattern disruptions, or lack of energy. There are many different types of depression, including major depression, persistent depressive disorder, and seasonal affective disorder. The most common type is major depression. Why you may not recognize depression. Sometimes people's behaviors and unique personalities make it difficult to discern whether they are experiencing depression, and sometimes changes in routine or behavior may have explanations other than depression as well. In addition, some who experience depression don't want to discuss it publicly. There are many reasons this may be the case, including societal stigma or fear of being stereotyped. What are signs of depression? Understanding signs of depression can be challenging because each person is unique and complex in their own way. The signs of depression can look very different from person to person and may depend upon variables like timing, circumstances, cultural or familial influences, past experiences, and more. There are, however, some relatively common signs of depression that may provide you with some clues about a person's mental state. Number 1. Loss or increase in appetite. A total lack of desire for food may be a serious symptom of either depression or other medical conditions. This points to the possibility of an unhealthy cycle of lack of appetite as a symptom of depression, leading to poor nutrition, which exacerbates the symptoms of depression. However, some people can feel compelled to overeat. This demonstrates that how much a person eats doesn't necessarily signal depression. It's the change in behaviors around eating that may be an indicator. Number 2. Engaging in risky behaviors. There are several potential motivations behind why people experiencing depression may exhibit risk-seeking behaviors, one of the most common being the misuse of drugs and alcohol. But numbing behaviors as a potential indicator of depression aren't limited to drugs or alcohol. Distracting or numbing behaviors may include gambling, sex, or pornography. People may also turn to binge eating or compulsive shopping. Even a person's job or career can be a source of compulsion. Number 3. Verbal cues. If a person's normal topics of conversation begin to change to include things like feelings of powerlessness, a poor sense of self-worth, or a lack of hope, it may be an indicator that they are experiencing depression. The same applies to the frequent, unusual use of phrases referring to themselves negatively, such as "I am useless" or "I feel stupid." It's important to note that it's not unusual for a person's focus to shift to topics like these occasionally, but if you notice it's become constant, without any other context, now is a good time to gently reach out. Number 4. Loss of interest in pleasurable activities. Loss of interest in sex is strongly associated with depression in adults, but a sudden loss of interest in any activity one normally enjoys could be an indicator of depression. Number 5. Sudden better mood following a positive stimulus. It may seem counterintuitive that this behavior should be an indicator of a larger problem, but sudden improvement in mood is a common symptom of a type of depression called atypical depression. It usually occurs in response to good news or positive events, but you'll quickly notice that it's temporary and often followed by a crash, resulting in worsening depression. Signs of depression in children and adolescents. Children exhibit many of the same behaviors related to depression that adults do, but the reasons behind a child's depression are a little more difficult to pinpoint, possibly due to differences in the ability to communicate succinctly with therapists. The teen and adolescent years are typically also challenging for most young people. The reasons for this range from physical changes in the body and academic pressure to increasing complexity in relationships and more. The signs indicating clinical depression in teens are much the same as those for adults, with the additional proviso that they tend to be more dynamic and prone to change with age. Talking to others about depression. If you suspect a colleague or friend may be experiencing depression, it's essential to be mindful if you decide to approach the subject with them, and it is recommended to gently letting the individual know you're concerned and that you are available whenever they feel like talking. Sometimes, the effort to engage in a friendly and supportive conversation can be misconstrued as a negative intention. Remember that everyone processes feelings of depression differently. Talking about your feelings of depression with others. If you recognize symptoms of depression in yourself, professional counseling is highly recommended. Although there are, sometimes, challenges involved with seeking treatment, psychotherapy is one of the most effective ways to learn the coping strategies you need to move past depression and begin the path to healing. Treating depression. There are many different treatments and resources for depression. Psychotherapy, medication, group therapy, and electroconvulsive therapy are among the most common. If you or someone you know exhibits signs of depression, it's important to get help as soon as possible to work through those feelings and try to prevent any worsening of symptoms. If you're ready to take control of your own depression, reaching out to a mental health professional in person or online is the first step. A therapist may assist you in uncovering the roots of your depression and the things in your life that might contribute to it currently.